Welcome to Module 7, Good Health Counts, Measurement and Evaluation for Health Equity. Here you will learn about community health indicators and how they can be used to assess and monitor conditions that influence health and safety. We will highlight a number of indicator reports that have been used to advance health equity efforts. After completing this module, you will understand why community health indicators, indicator reports, and report cards are valuable tools to improve health equity, and you will be able to identify elements of successful community health indicator efforts. In Module 3, we described the 18 community factors shown here. We noted that these factors influence health and safety in every community, and we emphasized that some communities have an abundance of health-promoting factors, while others lack supports for health and safety. This module focuses on community indicators, a type of data that can reflect what is or isn't contributing to health and safety in the broader community. Many of the factors shown here can be the basis for useful indicators. So what are indicators? Here's an easy-to-understand definition. An indicator is a small bit of information that reflects the status of larger systems. The gas gauge and speedometer are classic examples, and so is body temperature. The term indicator can mean one or more pieces of information or data that provide useful information about the current status of something. Taken at different points in time, indicators can also be used to show trends or progress. Here are several examples of indicators that can be used to measure community health and well-being. For example, the number of preventable emergency room visits in a community may be indicative of adequate primary care, residents' insurance rates, or high rates of injuries. Another indicator, access to parks and playgrounds, could be used to describe the physical environment by telling us about opportunities for physical activity, the presence of open space, or perceptions about safe places to play. The final sample indicator, salmon spawning, is a good example of an indicator that is tailored to a unique community context. In places like Seattle, Washington, wild salmon runs are linked to the local economy, recreation, food production, and environmental quality. As the indicators on the previous slide showed, the health of a people is measured by more than death rates. It also comes from an improved quality of life. Traditionally, public health departments have measured important information like birth and death rates, new cases of disease, and burden of injury. In addition to these sentinel indicators, there are many other types of data that can tell us about the health, safety, and well-being of a community. In Cleveland, Ohio, for example, their Social Indicators project provided data on many of the determinants of health. Education, employment, income, housing, and youth development measures gave community organizations data they needed to better understand the neighborhoods they serve, to develop effective proposals, and to evaluate progress. How do we create indicators that accurately capture the information we need? An important step is using or developing criteria for indicator selection. Some criteria are listed here. A quality indicator uses the best available information to guide decision-making. Beyond traditional measures, community indicators should give people valuable data about the physical, sociocultural, and economic environment. Indicators can also bring attention to assets in a community and provide credible information about what needs improvement. In addition to describing the health of a population, indicators should matter to the community and influence decision-making. In West Oakland, California, residents and community groups work together to research and identify 17 indicators to help them monitor environmental, health, and social conditions in their neighborhood. The West Oakland Environmental Indicators Project provided residents with data to propel their health and environmental justice efforts forward. Concerned about high rates of cancer, asthma, and lead poisoning, residents linked health indicators to pollution levels. Then they used the indicators report to issue a formal request to the Bay Area Quality Management District. residents requested stronger regulations requiring one of the area's worst polluters, the Red Star Yeast Factory, to reduce emissions and noxious odors. Ultimately, the combination of evidence and strategic pressure led to a victory for the community. As the West Oakland example powerfully shows, what we measure often defines how we see the world. Indicator reports can help shape how health and safety issues and their solutions are viewed. Indicators can be used by public health departments, community-based agencies, and others working to bring community health to the center of decision-making and priority setting. Community indicator reports and report cards are used to package indicator data in an understandable format. For the purpose of this module, community indicator reports are published reports using a carefully selected set of indicators to track the social, health, and economic conditions in a defined geographic area. Report cards are a type of community indicator report that use letter grades or rankings. So how do we package data to create effective indicator reports? Good Health Counts, a document prepared by Prevention Institute, synthesized findings from over 80 community indicator reports and report cards from across the country. It provides examples of indicator reports and highlights successful elements. We'll touch on some of them now. In our analysis, we identified several important elements of indicator reports. They are listed here. For example, an effective tool helps track progress and trends over time and offers some insight about the magnitude and direction of change. An effective tool presents information in a clear way that leads to action, and it establishes accountability. It should reflect the community factors that need to be changed and the sectors, systems, or institutions that are responsible for changing them. As indicator reports go, the Boston Indicators Project is widely recognized as a model. Boston has used indicator reports for the past 10 years with a plan to continue until at least 2030. The project provides a standard set of information to community stakeholders. It has allowed people to observe trends over time across a range of sectors, including health, housing, and education. The Boston Indicators Project has also been recognized for its commitment to civic engagement, the comprehensiveness of its framework, and its efforts to provide both neighborhood and metropolitan scale data. Charlotte Kahn, Executive Director of the Boston Indicators Project, has observed that reports can connect the dots for people. They can tell a story through data. She has found that journalists use indicator data to provide background for their stories. Community-based organizations use the indicators to write proposals and evaluate programs. Community leaders also come together to discuss indicators using their reports as a shared frame of reference. What Boston and other examples around the country suggest is that indicator reports and report cards can be used to foster engagement and collaboration among community stakeholders, define community assets and areas in need of improvements, point out community conditions that shape behaviors and exposures, compare one part of a community to another, or compare a community to itself over time, inform policy and practice, and get media attention. An effective tool also presents information in a clear way that leads to action. In Alameda County, California, the report, Life and Death from Unnatural Causes, details health and social inequities throughout the county. It was developed after the Alameda County Health Department released its 2006 Health Status Report, which documented indicators such as increased concentration of wealth, decreased affordability of housing, increasing school segregation, and growth in non-living wage jobs. The Life and Death Report presented stark facts. For example, an African American child born today in Oakland's flatlands will live an average of 15 years less than a white child born in the wealthier Oakland Hills. And for every $12,500 in income difference between families, people in the lower income family can expect to die a year sooner. In addition to showing leading indicators, the report articulated policy recommendations. The recommendations were directed to many sectors within the county, such as housing, planning, and community development. This framed health inequity as the broad responsibility of many groups within the county. This has spurred new partnerships, community engagement, and resulted in several intensive place-based strategies in defined communities throughout the county. An effective indicator report also establishes accountability. Let's take a closer look at using a report card to frame accountability. The prototype of a community health intersectoral report card shown here highlights a range of sectors within government. It also lists sample indicators relevant to each sector. As the lead public entity responsible for the health of a community, public health departments could utilize such a report to engage other sectors in local government to identify key indicators, define strategies for addressing them, clarify roles, and develop a system for tracking progress over time. But keep in mind, a tool cannot be effective without an effective process. As listed here, an effective process builds a shared vision for community health, engages the community, and brings the right players to the table. The process of developing community indicators and indicator reports helps identify key opportunities and community goals. The process can build trust, relationships, and ensure accountability among partners. In Jacksonville, Florida, for example, the Jacksonville Community Council relies heavily on community participation to develop and review its quality of life assessment. Their annual process is driven by strong commitment to community engagement and a unique dedication to objective leadership. The project engages diverse citizens in open dialogue, research, consensus building, advocacy, and leadership development. Politically conservative and liberal members alike serve on committees and boards and successfully reach consensus on report recommendations and conclusions. Jacksonville's focus on indicators has been going on for decades, and it is a heralded example. One of the things that they track is racism, and they have set targets for reducing perceived levels of racism in the community. In Jacksonville, large numbers of people have had a hand in the development of the report. For this reason, many stakeholders are invested in it, and they rely on its information. The Jacksonville Quality of Life Progress Report goes way beyond a summary of official statistics to include community voice and community analysis. An engaged community can create a better product and a better process. Neighborhood associations, local nonprofits, unions, and youth are among the key community voices that should be invited into indicator efforts. As the executive director of Jacksonville Community Council said, ultimately, community indicator reports are not about the indicators. They are about community change. Developing a community indicator report or report card facilitates dialogue on what really matters. It can translate collaboration into a meaningful product. It can also allow communities to think through a vision for a safe and healthy future. A vision should capture what residents already value in their communities. It should also reflect areas in need of attention or improvement. When developing a vision, it is critical that all members of the community are considered. This means including the voices of youth, ethnic communities, sexual minorities, older adults, the disabled, and disenfranchised groups. Lastly, a clearly articulated vision and set of positively stated values serves as an anchor for an indicators project. Its worth should not be underestimated. Community stakeholders can be involved in many ways. Community members should be enlisted in the priority setting process. Brainstorming and planning with the community early on will help define the most important indicators. Community members can be engaged through local surveys, community forums, and task force groups. Their input should complement and clarify traditional sources of data collection. Once the community has been involved in priority setting and data collection, indicator data should be shared back with the community. This gives community stakeholders an opportunity to interpret the findings and use them to inform local policy decisions by empowering them with data. This data can highlight the community's key change agents and be used to hold elected officials accountable for action or inaction on critical community concerns. Community members can also be included in project oversight. Project oversight can include participation in advisory boards, serving on task force groups, and providing feedback on products as the process moves forward. In addition to engaging community members, an effective process involves building broader partnerships. Developing reports and report cards often requires the engagement of multiple sectors and individuals in creating solutions. Solutions not only need to address public health problems, but also environmental, social, and economic concerns. The Boston Indicators Project, for example, periodically convenes a series of What's Next? These seminars bring together young, emerging, and established leaders in ongoing dialogue to better understand and respond to challenges highlighted in the Boston Indicators reports. In Seattle-King County, the Communities Count Partnership prepares an indicator report every 3 years to provide residents and decision makers with data on 38 indicators, including safety and health, environment, and community strength. An analysis of health disparities found in Communities Count 2005 was provided to the Health and Human Services and Race and Social Justice Subcabinets, a cross-department implementation team for the Mayor's Race and Social Justice Initiative, 3 specific department management teams, and the Seattle Women's Commission. The King County Board of Health requested a special report on health disparities based on the results of the Communities Count data. The King County Equity and Social Justice Initiative used community indicator data, including some of the Communities Count initiative, to guide county-level decision-making and policy development, partnerships, and service delivery across diverse county agencies from Health and Human Services to Transportation and Law Enforcement. To recap this module, we defined health indicators and discussed criteria for developing effective community health indicator reports. We demonstrated the value of community health indicators and indicator report cards for improving health equity, and we illustrated that community health indicator reports are important because they contain information useful to the community. As this module has shown, well-selected indicators presented in an understandable report can have a tremendous impact on policy and practice. It's important to remember that an effective indicator report is valuable for process reasons as well. When people are truly engaged in defining and tracking indicators, they will not only be more invested in helping to bring about community change, but they will also have had meaningful opportunities to engage with other community leaders, including health departments, in efforts to achieve equitable health and safety outcomes. This module concludes the Health Equity and Prevention Primer series. We hope you have found the information contained within these modules useful and that you will feel confident in applying the tools and methods covered in your own communities. Please visit preventioninstitute.org for frequent updates and resources on primary prevention and health equity.